Hey everybody, this is Andy Scott with Medic, coming to you with a video to explain the 2026 VBR measures. Okay, so a couple things to look at here. The first one being the timeline of the 2026 VBR period. This is the same as last year, no changes. The performance period runs September 1st, 2025 through August 31st of 2026. This is different than the P for P period, so keep that in mind. The actual payment period runs March of 2027 through February of 2028. As a reminder, so whatever you earn in this performance period, being September of this year through August of next year, is then paid out in March of 2027 through February of 2028. All right. So for the structure of the VBR, basic same overall structure as we've had the last couple of years. So three different VBRs are available to Medic members. The first being a 3% collaborative wide performance VBR, the second being a 2% hospital performance VBR, and then finally a 2% smoking cessation VBR. The overall structure is the same as it's always been. One big difference is there are some differences in the 2% hospital performance VBR, which we'll get into as we go through these one by one. Okay, so the first one is the 3% collaborative wide performance VBR. This is one of the first VBRs that Medic has ever had. Up until last year, we only did our two head injury modules or measures, so the PEDS minor head injury and the adult minor head injury. Starting this 2025 year, we added in chest X-ray, and instead of having to meet both measures, now it's 2 out of 3. So there's a little bit more wiggle room for the collaborative as we grow to make sure that we get this VBR. So as a reminder, this is a collaborative wide VBR. So 3% is available. Everyone in Medic that's VBR eligible is participating in this. If we meet 2 out of these 3 measures, all eligible physicians at the eligible hospitals get the 3% VBR. If we don't, nobody does. So this is the kind of the team sport aspect of the Medic VBR program. So we got to get 2 out of 3 of these to get the 3% VBR. And the 3 that we're working on are the pediatric head injury, which is the first one on here. So less than 25% utilization of head CTs, less than or equal to 25% head CTs in kids with minor head injuries. Adult head CT appropriateness, so 62% or greater. And then chest X-ray utilization for kids with asthma, bronchiolitis, or croup, less than 30%. So again, as a collaborative working together, we must hit 2 out of 3 of these to earn this 3% collaborative wide VBR. 2 out of 3 targets. Okay. The next one is where we've made some changes. So if you have remembered the last couple of years in this 2% VBR, we used to call it the individual physician VBR. So this is the one where your doctors had to have a Medic Tableau account, they had to log in at least once a year, and they had to fill out a performance survey, in addition to your hospital meeting a performance target. Based on feedback that we've gotten from the Medic Executive Committee and from our membership, we are eliminating the participation portion of this VBR. So in 2026, you will no longer have to get all your docs to have Medic Tableau accounts, although it would be really cool if they did. And I think we all think that that's better for engagement and performance, but it is not a requirement of this VBR. They don't have to have an account. They don't have to fill out the survey in 2026. They do still need to complete the 2025 work to get the 2025 VBR. But going forward, after this year, we will no longer require that individual participation from your doctors. What you do need to do to earn this 2% VBR is to choose one of these 8 measures as your hospital-specific VBR. Then you need to meet the target on that as a hospital or group or however you're enrolled in Medic. So you choose one of these measures. If you meet the measure, all of your docs that are in PGIP, in a PO, and are eligible receive an additional 2% VBR for that. So we've got another change in this is that previously we've only offered the first 4 on the list. Now we're offering another 4. So you have 8 things to choose from. So this is something where you will need to make an active decision on which measure you're working on. So just to walk through the 8 measures quickly, the pediatric head injury, CT utilization, less than or equal to 25%. The adult head CT appropriateness, greater than or equal to 62%. Diagnostic yield for suspected pulmonary embolism. We dropped the target down a little bit here. It's been 8.5% for the last couple of years. It's down to we need it to be greater than or equal or 8%. We know that this measure is a struggle, and we hope that some sites will want to choose this to kind of help, level off performance on this a little bit. So that's PE, chest X-ray utilization for kids with asthma, bronchiolitis, or croup. We're looking for less than 30% utilization there. And then the new ones we've added in are chest pain, so greater than 95% as a group on your lowest chest pain, discharge, greater than 95% discharge, um, greater than 18% compliance to our new pediatric asthma bundle, over 50% distribution of naloxone for your patients with opioid overdose. And then for the sites that are doing pediatric readiness for the P for P, that's kind of a separate conversation. But if you have been selected and you've already been notified if you have, if you're doing pediatric readiness in 2026, you can also use that as your VBR measure. Assuming you get up to the 87 points on the survey, you can use that for your 2% VBR measure. Okay, so what do you have to do on this hospital VBR? Again, no more individual physician participation, but there are some things that we need you to do as a site and a clinical champion or a representative of your hospital here. So first one, choose one of the 8 measures. Let me know by October 1st. Second, meet the target. So you go, through the course of the performance year, which again is September of 2025 through August of 2026, meet the target to be eligible for the 2% VBR. Once you meet the target, all of your PGIP eligible physicians will earn the 2% VBR. Points 4 and 5 here, just a little bit of clarification. So the first part is that your individual, a little bit of a reiteration, but the individual physician does not need to meet the performance target as long as the site has met the target. Flip side of that is that if the site does not meet the target, none of the physicians at the site get the increase. So it's kind of all or nothing within your site. If you meet the target, you're all eligible. If you don't, nobody is. Even if you have individual performers who meet the target, they are not eligible for this incentive if the site itself did not meet the target. Okay, our final one is the optional 2% smoking cessation VBR. Made 2 changes on this one this year. One is to the measure, a little bit to the measure inclusion itself. So up until this point, we've only worked on COPD patients, but after a little work with the CQI team, with Blue Cross, and with some consultation with some folks at the state of Michigan, we are offering asthma as an option for this VBR measure. So you can work on asthma patients if you want instead, or in addition to COPD patients, just let us know. The other change is on the target itself. So in the previous years, we've had, or last year, this current year that we're finishing up, the target was 1 month at 25% or higher, or 3 months at 10% or higher. As we've done better on this and sites have improved, the target goes up like it does with all of our measures. So the target for 2026 will be 1 month at 30% or 3 months at 15%. Quick note here is that you don't have to make an actual choice here or an active choice here. Send your data, do the smoking counseling. We will look at your data. If you hit 3 months at greater than 15, or if you hit one with 30, we will give you credit. You don't have to, you're not working towards one of these, you're working towards either of these as you go. So we will keep an eye on the data and give you credit for whichever of the ones that you actually meet. So the steps you have to do for this, again, this is optional. If you're already doing it, you're already sending your electronic data over through your monthly uploads. There is no abstraction for this. If you're interested in doing this and have not done it in the past, please reach out to me, to Andy, and I can talk you through how to get your data transfer set up and how to, can probably connect you with some hospitals who have been doing this and succeeding at this measure to just make sure that you actually get what you need to be successful here. So 3 things you have to do. You got to choose, the big thing you got to do is choose your target population if you're already participating. So are you doing only admitted, only discharged, both admitted and discharged? And newly this year, are you doing COPD or asthma, or both COPD and asthma? Yeah. Okay. So the last thing that we talk about here is just, wrapping up the whole 2026 Medic VBR. 3 steps, everyone needs to do. So one, as always, make sure that all your docs are enrolled in a Blue Cross PGIP PO. If you aren't, that is the the mechanics, the method that you actually get paid. If you're not in the PO, Blue Cross will not give you the money. If you need help getting enrolled, or if you need help figuring out who is and who is not enrolled, please reach out to me. Medic doesn't do this directly, but I've kind of figured out who to talk to within Blue Cross to kind of get you connected to the right people to make sure all your people are enrolled. So that's number one. Number two, for the 2% hospital VBR, tell me which measure you're working on by October 1st. If we don't hear from you, we default you into head injury. So if you don't like that and you want a different one, you have to actually reach out and tell me which one you want. And then if you are doing the 2% smoking VBR, make sure you're sending all your data and send me your target population again by October 1st. So um, that is the Medic VBR. In the email that comes out, I'll lay some of this out. We'll have one pagers to kind of help you understand what you need to work on. And as always, if you have any questions, please reach out to me, Katie, Megan, any of the team here at Medic. We are more than happy to talk you through and make sure that you can be successful on these measures. Thanks.